What if the smallest lump in your neck could be the earliest sign of something life-threatening, yet completely curable? Thyroid cancer is often called the silent threat because it hides in plain sight, masked by symptoms so subtle that many people brush them off. As of early 2025, over 44,000 new cases of thyroid cancer have already been recorded in the United States, and it's not slowing down. What makes this more concerning is that thyroid cancer doesn't just target the elderly, it often affects younger adults, those in the prime of their lives. But here's the encouraging truth. When detected early, thyroid cancer is highly treatable. That's why in this video, I'm going to walk you through 5 critical warning signs that could save your life or someone you love. These are signs I've seen time and again in my 10+ years working with patients, small, persistent changes that many overlook until it's too late. I'll help you understand what to watch for, why it matters, and what steps to take next. So please, don't ignore this. And especially pay attention to sign number 3. It's one most people miss, but it could be the key to early diagnosis. If you care about protecting your health or looking out for a loved one, take a moment to like this video, subscribe to the channel, and leave a comment below if any of these signs sound familiar. Your comment might just help someone else catch it in time. Let's begin. 1. A lump or swelling in the neck. One of the earliest and most common warning signs of thyroid cancer is a lump or swelling in the front of your neck, usually just below the Adam's apple. And here's the tricky part, it's often completely painless. That's why so many people don't notice it at first. In my experience as a health professional, I've had patients tell me they only discovered it by accident. Some noticed it while shaving, putting on a necklace, or looking in the mirror. Others were alerted by a loved one, or it came up during a routine checkup. In some cases, it's easier to feel than to see, especially if you have a fuller neckline. But if you gently run your fingers across the front of your neck and feel something unusual, firm, rounded, or slightly mobile, it's worth paying attention to. What makes these lumps concerning is their connection to the thyroid, a butterfly-shaped gland that moves slightly when you swallow. So if you feel a lump that moves up and down with swallowing, that's another key signal it may be thyroid-related. Now, not all lumps mean cancer. In fact, benign thyroid nodules are fairly common, especially as we age. But here's my professional take. New lumps should never be ignored. A simple ultrasound or fine needle aspiration, FNA, can help determine if the lump is harmless or something that needs closer evaluation. The bottom line? If you feel or see any new swelling in your neck, don't wait. Get it checked by your doctor. Early detection could be the difference between a simple outpatient treatment or a much more complicated path. Let's move on to the second warning sign, which is often mistaken for a common sore throat, but is something far more persistent. 2. Persistent neck and throat pain. Now let's talk about something that often gets overlooked, neck and throat pain. Not the kind that comes with a cold or from sleeping in the wrong position. This one feels different, and it tends to linger. In clinical practice, I've met patients who described it as a dull, nagging ache in the front of the neck, right where the thyroid gland sits. It wasn't sharp or intense, but it just wouldn't go away. What's more interesting and concerning is that this pain can sometimes radiate toward your ears. That's because the thyroid shares nerve pathways with the ear region, which means the discomfort isn't always localized. You might feel it travel upward or notice a tender, bruised sensation when you press gently on your neck, even though there's no visible injury. Some people report that it gets worse when they lie flat in bed or turn their head a certain way. Others say it started off subtle but gradually became more noticeable over weeks, even months. That's the key difference here. This pain doesn't behave like typical muscle soreness or throat irritation. It doesn't respond well to over-the-counter pain relievers, heating pads, or rest. From a medical standpoint, persistent pain in the thyroid area should always be taken seriously, especially if it's paired with other symptoms like a lump or voice changes. While not all chronic neck pain points to thyroid cancer, it's one of those signs we don't want to ignore. So if you've been feeling this kind of discomfort for more than a couple of weeks, and it just doesn't seem to improve, it's time to check in with your doctor. Let's move on to warning sign number 3, which is especially sneaky: changes in your voice. 3. Changes in your voice. Now here's a symptom most people don't associate with thyroid cancer: voice changes. But as someone who's worked with thyroid patients for over a decade, I can tell you, when your voice starts sounding different for no obvious reason, it's worth paying attention. The thyroid gland sits just below your larynx, also known as your voice box, and very close to the recurrent laryngeal nerves, which control your vocal cords. So when a tumor develops in the thyroid, even a small one, it can start to press on these nerves, leading to subtle but persistent voice issues. You might notice your voice becoming hoarse, raspy, or weaker than usual, almost like you're recovering from a cold. But here's the key. Unlike a cold, this change doesn't go away after a few days. You might find yourself clearing your throat more often, struggling to project your voice, or feeling like it takes more effort to speak, especially after a short conversation. Some people even report difficulty hitting certain notes while singing, or their voice sounding uneven throughout the day. I've had patients tell me they didn't think much of it at first. Maybe they were just tired or had allergies. But when their voice didn't bounce back after a couple of weeks, it turned out to be something more serious. From a clinical perspective, any unexplained voice change lasting longer than 2 weeks deserves medical attention, especially when it comes with other symptoms like neck swelling or throat pain. An E&E specialist can perform a laryngoscopy to check your vocal cords and see if there's external pressure coming from a thyroid mass. Your voice is one of the earliest ways your body might try to tell you something's wrong. If yours suddenly sounds different and stays that way, don't chalk it up to age or strain. Take it seriously. Next, we'll look at another sign that often creeps in quietly: trouble breathing, especially when lying flat. 4. Difficulty breathing. Let's talk about a symptom that can be especially unsettling: trouble breathing. This isn't your typical shortness of breath from climbing stairs or catching a cold. It often starts off quietly and builds over time, and many people don't connect it to their thyroid at all. But here's what I've seen over the years. When a tumor grows in the thyroid gland, which sits just in front of your windpipe trachea, it can slowly begin to compress your airway, almost like pressing down on a garden hose. You might not notice it at first, but over time, simple things like lying flat in bed or going for a brisk walk might suddenly feel harder than they used to. Some patients describe a tightness in the throat, or the feeling that they just can't get a deep, satisfying breath. Others report wheezing or whistling sounds when they inhale, especially at night. And here's something I hear often in clinic. I've started using extra pillows to sleep because breathing feels easier when I'm upright. That's a major red flag. Unlike asthma or a respiratory infection, thyroid-related breathing issues don't usually improve with inhalers or rest. The problem isn't in the lungs, it's a physical blockage that narrows the airway from the outside. Medically, this kind of progressive breathing difficulty, especially when lying down, warrants immediate evaluation. An ENT or endocrinologist can order imaging studies like an ultrasound or CT scan to assess whether your thyroid is putting pressure on your trachea. If you've noticed you're getting winded more easily, or you're constantly adjusting your sleeping position just to breathe comfortably, don't wait. These could be early signs of something serious developing quietly behind the scenes. Up next, we'll look at a symptom that most people dismiss until it becomes disruptive: difficulty swallowing. Let's explore what that feels like and why it matters. 5. Difficulty swallowing. Let's move on to a symptom that often sneaks in quietly: difficulty swallowing, also known as dysphagia. On the surface, it might not seem alarming. But if you've ever felt like food gets stuck in your throat, or like you need to drink extra water just to get something down, your thyroid might be trying to tell you something. You see, the thyroid gland wraps gently around the front of your esophagus, the tube that carries food from your mouth to your stomach. When a tumor begins to grow in the thyroid, especially if it's on the larger side, it can press against this food pipe, narrowing the space available for food to pass through smoothly. Over the years, I've had patients describe it in different ways: a tightness in the throat, a feeling of pressure, or a subtle sensation that solid food just doesn't go down like it used to. At first, it might only happen when eating dry or bulky foods like bread or meat. But as the tumor grows, even swallowing liquids or soft foods might become uncomfortable. This symptom often develops slowly, which is why so many people ignore it or chalk it up to stress, age, or acid reflux. But here's the professional truth. If you feel like swallowing takes more effort than it used to, or if eating has become a chore rather than a comfort, you need to get evaluated. A neck ultrasound or a swallow test can reveal whether the thyroid is putting pressure on the esophagus. And if it is, catching it early makes all the difference. So if you find yourself chewing longer, sipping water with every bite, or avoiding certain foods altogether, don't ignore the signs. Difficulty swallowing isn't just an inconvenience, it could be a signal your body is quietly sounding, and it's time to listen. Coming up, we'll tie it all together and show you what steps to take if any of these symptoms feel familiar. You don't want to miss it. By now, you've learned about 5 early warning signs of thyroid cancer: a painless lump in the neck, persistent throat pain, unexplained voice changes, breathing difficulties, especially when lying flat, and trouble swallowing. Each of these signs may seem minor on their own, but together, they could point to something much more serious happening beneath the surface. The truth is, thyroid cancer often starts quietly. It doesn't shout, it whispers. That's why I always tell my patients, it's not about panic, it's about awareness. The earlier you catch it, the more options you have, and the better your outcomes will be. In many cases, early detection means outpatient treatment, no radiation, and a full recovery. If any of these symptoms sound familiar, whether in your own body or someone you love, please don't ignore them. Talk to your doctor. Ask for a thyroid check. An ultrasound is quick, painless, and could give you peace of mind or catch something important early on. And I'd love to hear from you in the comments. Have you ever experienced any of these symptoms? Do you know someone who has been through thyroid cancer? Sharing your story might help someone else recognize a symptom they've been overlooking. Speech balloon, drop your comment below. Let's create a community of awareness and support. Thumbs up if you found this video helpful. Hit that like button. Bell, and don't forget to subscribe so you won't miss upcoming health content that could protect your life or someone else's. Because when it comes to your health, knowledge isn't just power, it's prevention. Stay alert, stay empowered, and I'll see you in the next video.